Mandy asked, how do you know you are correctly healing your DR? Okay, so I kind of covered this a little bit in talking with Ivania about how she actually noticed that her depth was decreasing in her diastasis. That is one way to know that you are advancing. First of all, please self-test. I have a self-test on my YouTube, and I have links to that in the announcements in this group. I want you to start with a self-test. Make sure, I think, Mandy, I'm pretty sure you've probably done a self-test. I see you very active in this group in the past. But you want to make sure you test your width and your depth. I do have a more in-depth assessment for my 8-week core challenge, ladies. It's way more involved because we talk about a lot more different things. But those two are very good indicators about what's going on. Just like with Ivania that we were just talking about. She noticed that as she tested that her depth was decreasing. That's a wonderful sign, okay? So that would be my number one thing to do, is just make sure you're doing your self-test, okay? The in-depth assessment, I don't feel like it makes as much sense outside the 8-week core challenge. That would be a good thing too. If you message me privately, we can talk about other things that you might be concerned about. I'm not sure, what exactly you're feeling or sensing, or if you feel like you're not making progress and why. But depth and width is going to make a difference. And if you're not noticing any changes there, then you have to start doing something differently. Whether it is, making sure you're connected to the right parts of your core so that you can make sure you're targeting those specific core muscles to help to tighten. Not only that, but a problem that we often see is that ladies will continue doing the same types of exercises without progressing. You're going to have to increase the load to your deep core so that you can continue advancing and making improvements. Obviously, you want to find improvements in your pelvic floor as well. If you're finding that your leaking is not getting better, but it's getting worse, or you're getting more pressure down in your pelvic floor, then you might not be healing correctly, and you just want to kind of reevaluate what it is that you're doing. If you're doing a lot of traditional ab exercises that aren't focused on mamas who are postpartum, you could be doing things that aren't optimal or ideal for healing your diastasis recti. So that would be important to assess. I have a video that I mentioned in my VIP group today. It's what exercises can we do, and it's questions that you would ask yourself of signs where you would know, like, I might not be doing something right. I'm not feeling good, whether it's pain, whether it's pressure, whether it's excessive doming. I'll post that when I get off of this live. I'll post that in this group, my general Mommy Mango Diastasis Recti group, so that you can review those things. Because if your answer to those questions are not positive, then maybe you're doing something that's not going to be helpful for you. Okay, so how do you know you are correctly healing your DR? In short, you want to do self-assessments before and after. You want to keep up with your assessments. And if you jump into the 8-week core challenge, then I have more in-depth assessments. So it's really just about assessing yourself and seeing, what's going on. All right.